EUS-guided decompression of a large mucinous cyst via electrocautery-enhanced lumen-apposing metal stent. We present a case of a 94-year-old female who presented to our office initially with complaints of dysphagia to solids, weight loss, and nausea. The patient reported an approximate 15-pound weight loss in a 2-month period, and given these complaints, we recommended an upper endoscopy, which was subsequently performed. As you can see in this image of the retroflexed view of the stomach, there's extrinsic gastric compression near the cardia and the proximal aspect of the lesser curvature. After findings of extrinsic gastric compression, it was recommended that the patient undergo a CAT scan of the abdomen and pelvis as well as an upper endoscopic ultrasound. CT scan of the abdomen revealed a large cystic lesion arising from the body and tail of the pancreas. This measured approximately 14 centimeters in size. As you can see in this image, the cyst is composed primarily of fluid with some solid debris. The 3 smaller arrows represent an area of extrinsic compression directly upon the lesser curvature of the stomach. Next, the patient underwent upper endoscopic ultrasound. This revealed a large cystic lesion arising from the body and tail of the pancreas. As you can see in this image here, the lesion is primarily composed of fluid with some solid debris. It measured approximately 7 centimeters in maximal diameter. Fluid studies revealed a significantly elevated CEA as well as amylase level. It was also sent for a molecular profile which showed GNAS to be positive. The cytology was negative for malignancy, and overall the characteristics of this cyst were most consistent with an IPMN. After initial EUS and cyst fluid studies were done, the patient was deemed a poor surgical candidate based on her advanced age. Given her symptoms of dysphagia and weight loss, treatment options were discussed. Historically, surgery is the treatment of choice for these high-risk cystic lesions. Alternatively, studies have demonstrated that cyst ablation with ethanol and paclitaxel have shown to be potentially beneficial. After discussing these options, it was mutually decided that a cyst gastrostomy would provide the most rapid relief of her symptoms. The patient and family agreed to this off-label approach and fully accepted the potential risks. The stent delivery system creates a durable anastomosis between the stomach and the pancreatic cystic lesion. It is designed to facilitate seamless access into the target lesion or structure by providing an all-in-one electrocautery and stent delivery system. As you can see in this endosonographic view, the ceramic-tipped catheter creates a high current density and allows for an easy and efficient cut into the cystic lesion. After access is obtained, the first phalange is deployed, as demonstrated here. After full deployment, it is pulled back against the interface of the gastric and cyst walls. This allows for optimal deployment of the second phalange within the gastric lumen. Next, attention is paid to the endoscopic view for release of the second phalange. As you see here, the stent is successfully deployed and visible within the stomach, and with adequate suction, thick mucinous debris is extracted from within the cyst, providing decompression of the cystic lesion. 1 month post-cyst gastrostomy, the patient was feeling well and gained 10 pounds due to an improved ability to eat solid food. Unfortunately, she died 6 weeks after stent placement due to complications of a cerebral infarct. Optimally, subsequent follow-up with CT of the abdomen and pelvis would be advised to evaluate cyst size and level of decompression after removal of the lumen-apposing metal stent. This case demonstrates the utility of a cyst gastrostomy via electrocautery-enhanced lumen-apposing metal stent as a feasible and safe alternative for palliative decompression of a symptomatic cystic neoplasm of the pancreas. A longer period of post-procedural follow-up would be beneficial in the future to determine outcomes beyond 1 to 2 months.